where most countries in the world have decided to completely lock everything down, keep people indoors, and shut down the country, Sweden has gone for a different approach. Sweden has decided to keep the country fairly open, but require citizens to social distance themselves, to remain responsible, to limit gatherings to below 50 people. And I think, like older people are meant to stay at home, etc.
No, but I think you have made a fair description. Instead of closing it down completely, we have tried to look at different situations where we know that the spread is most dangerous, like in restaurants. And then we have regulated saying restaurants, you have to see to it that you're not crowded. You can no longer serve in bars, so people sit very close together for a long time. So we put a lot of responsibility on the restaurant owners. Another one is that we have told everybody to stay home if they feel ill in the morning, even if only slightly ill, stay at home. And because financially that's been okay, since nowadays you get paid even if you stay home when you're sick from the very first day, which the government changed very quickly. So there is a great incentive of staying home if you feel slightly ill. And we have done a lot of things to limit the social contacts among the elderly, giving advice to them to stay home and stuff like that. So instead of saying close down the whole society, we have looked at society and closed down the aspects of society where we think and we know from other diseases and from what we've seen in other countries, most of the disease spread is done. And I think that has had a great effect in many ways. It has enabled our health system to keep on functioning. It has had other interesting effects, like over Easter, Swedish people travel a lot. Only 10% of the normal travels were done, which is a lot of change. Our yearly epidemic of flu suddenly stopped when we instituted these measures in the middle of the normal wave.
Right.
So in that way, it's worked, and we have used sort of what we normally use in Sweden when it comes to public health, and that's really telling people to take responsibility and and sort of do the things they think will fit them the best in diminishing the threat to spread the disease to other people. And I think that's historically worked very well. I think we're trying to look at it holistically, and I'm not saying we were successful in all different ways. I mean, our death toll is really something we worry a lot about, and it's very much related to our elderly people's homes, who have proven to be extremely susceptible to this disease. And we know that there's a number of things quality-wise that needs to be addressed in those, and we are addressing them with a lot of other agencies involved, and we're seeing some improvements. But our death toll has very much to do with that. In other aspects, it's many of the things have worked, I think, reasonably well. And I think the good thing is that we've been able to keep schools open. Keeping schools open is very important for children and children's health. We know that for sure. We have been able to keep a lot of people working. And we know that losing your work is very dangerous to your health. So we've been trying to take a slightly more holistic approach to this than maybe some other countries have done.
What does herd immunity mean for you? And what are you hoping herd immunity will achieve for Sweden?
I think complete herd immunity, we're not sure any country will ever achieve, because that means that the disease goes away, and I don't really see this disease going away. But even some immunity in the population, like the 20-25% that we are reaching now, will have a great effect on the speed of spread. So with that and the measures we have in place, and with immunity going up, I think there is a possibility that we can ease down on some of the restrictions otherwise that we have, so that we, by the immunity level of the population, can have such a slow spread of the disease that the society can start work more or less normally again. Mm-hmm. I mean, some parts of it will always be at risk. I mean, elderly people will most likely always be at risk for this kind of disease and so on. But many things we can then ease up a bit on. Building up the trust between the agency and the population.
I think we have to be very careful about looking at those numbers and understand their basis. I mean, the first big number was the original mortality figure that is frequently cited of between 3 and 4% of infected patients. And that number really was a distortion, an overestimate by far as it's being analyzed now. The reality is that the fatality rate will be highly likely to be far under 1%, and possibly an order of magnitude less than that. Even approaching the sort of numbers that are dealt with in the flu. I think we have to be very, very careful of interpreting the numbers. Whole population isolation is not just economically problematic, it's biologically problematic, because there are fundamental principles of biology that you'd have to understand. It's probably true that 99% of people or more that are positive COVID-19 don't need any medical care. And this is very critical to understand. And then the other thing is to allow biological immunity to develop. That's how virus infections are typically eradicated. It's a big part of it. If you shelter everyone in place and avoid all human contact as an extreme, you cannot develop population immunity. Given the fact that the overwhelming majority of people who get COVID infection are either asymptomatic or mild symptoms, but don't need hospitalization, that is how the population develops immunity, ultimately controls the spread, and eradicates the virus, is to do a more strategic, focused quarantine isolation policy, not whole population. As I mentioned, there are reasons not to do it. So what do I mean by that? I mean restricting visitations to nursing care centers and the vulnerable. We want to protect the people who are going to die from this, who are sick, and everyone in their family. If you're exposed, okay, you're isolating yourself, but that doesn't mean total lockdown of every business. It's important for people to understand medical science, to know that natural human immunity of populations, that is sometimes called herd immunity. It's very important that that develops. That's how viruses are eradicated.
What's your view of the lockdown policy that so many European countries and states in America have introduced?
I think it is a huge mistake. For example, they found, as I understand, that children, even if they're infected, never infect adults. So why do we not have children at school? Why do we not have people working? England, France, Italy, Sweden, Belgium, Holland are all reaching levels of saturation that are going to be very, very close to herd immunity. So basically, and I think that's a good thing. I think the policy of herd immunity is the right policy. I think Britain was on exactly the right track before they were fed wrong numbers, and they made a huge mistake. I see the standout winners as Germany and Sweden. They didn't practice too much lockdown. They got enough people sick to get some herd immunity. The standout losers are countries like Austria, Australia, Israel, but didn't have many cases. So they have damaged their economies, caused massive social damage, damaged the educational year of their children, but not obtained any herd immunity. I think in many ways, the European countries are fine. They didn't need to have the lockdown, but they will have all reached a high enough level of infection not to have to worry about further future attacks of coronavirus. Many, many people have been really, really hurt, especially young people. I think that everybody panicked. They were fed incorrect numbers by epidemiologists. And, this, I think, led to a situation. There's no doubt in my mind that when we come to look back on this, the damage done by lockdown will exceed any saving of lives by a huge factor. One very easy way to see this virus, I'm just simply saying that the burden of death of flu is like coronavirus, especially when we correct for the fact that people who die from coronavirus are older on average than people who die from flu. Flu kills young people. It kills 2 or 3 times more people under 65 than does coronavirus. If we put those facts into the situation, we find that the burden of death from coronavirus, I'm fairly sure, will in Europe, where we have good numbers, be less than that of a very, very flu. Another factor which has not been considered are all the cancer patients who aren't being treated, or all the heart cardiology patients who aren't being treated. I've heard estimates of tens of thousands of people who are basically going to be dying because of lack of that treatment. And generally, again, the age group who die of cancer are younger than the age group who die of coronavirus. So if we could protect the old people perfectly, then the death rates would be very, very low. The thing that should have been done is for the media to stress to people that every day somebody dies, and these people are essentially in the same age band who die from corona, have other comorbidities, they have other diseases. And I'm getting documents from Italy showing that many of the COVID deaths were either dead before they were tested, or else they had up to 3 other conditions. So there's nothing wrong with this. People die for all sorts of reasons, but the news should be stressing this, and maybe they should be counting it as a 0.1 COVID death. Countries seem to be racing to have as many COVID deaths as they could. And this is a huge mistake. In the flu season, no one cares about these people. I mean, the total number of COVID deaths in Europe will be very similar to a severe flu season. And, you know, this is serious. Flu is a serious disease, but maybe we should just shut down the economy during the flu season. I mean, we need people should have been made to understand it.